Hello, I am Professor Gonzalo from Seville, Spain. I am the actual president or chairman of the Council for Cardiology Practice in Europe. That is one of the 5 councils of the ESC board. And with me, sitting behind me, is Professor Dr. Anton Sirnes from Norway. That is the past president, the past chairman of the council. And we are here for talk about our Council for Cardiology Practice and how it's organized. And Anton, tell us, how is the Council organized during the last years?
Well, the Council of Cardiology Practice, as you said, is one of 5 councils in the ECS, and it's one of the constituent bodies. In addition, we have the associations and the working groups. All the councils are focusing to bring together people with a similar professional identity, and our council is focusing on cardiologists practicing out of the hospital environments. So we have about 5,000 members throughout Europe. They are organized each within their country in an organization for practicing cardiologists or a working group within a national society. And we have about 10 members countries now in our council, and we would like to have more. So if your country doesn't have this group of practicing cardiologists, please contact the ESC Council and they will help you to organize it.
And tell us, Anton, what is the aim and the main activities of our council?
Well, the council was created 11 years ago, and the aim is to bring together practicing cardiologists with a common interest in cardiovascular medicine. And it's also to promote education and training of cardiologists and to develop standards for continuous medical education, for training and professional conduct. And we are also trying to focus on the conditions for practicing cardiologists across Europe. How is the working day? What type of patients do they have, and so on?
Okay, that's undoubtedly there are many important things that we have done during the last year. But what about the new projects? What about the future for the council in the next years?
Well, I will just try to remember one more main activities is the e-journal of the council. There are about 40,000 subscribers to this e-journal, and it goes out nearly weekly, and it's free of charge to subscribe to it. So it's a fantastic educational tool that goes to people all over the world. And the council has also many activities within the ESC to assist in the development of the Congress Committee and the guidelines work. Now, concerning new projects, we have now planning to start a survey among our members to try to focus on what kind of patients did I have on a specific day, what was the age distribution, what was the distribution of diseases that they were trying to look into, and what was the procedures done. And we will try to have a snapshot of the activities of cardiologists working outside the hospitals across Europe. We have also a new activity that goes on in a kind of hosting exchange program, so that one cardiologist practicing outside hospital will visit another colleague in another country and be a full day at his practice and observe what is going on, how many patients, what was done in procedure, and write a report in our newsletter. We are planning to have this kind of visits for the next years, and we have acquiring funds from the ESC to do that, and this will help us to compare the working conditions and how the practices function in each country, because we know there are very much differences both financially and within organization of the health system in the different countries.
Okay, that's very interesting, Anton. We are organized inside hospital, teaching hospital, university hospitals, but what we offer to the clinical cardiology, to the practitioner cardiology, what's our offer?
Well, being in our council, you can be part of our own educational tools. I mentioned the e-journal, we have also the newsletters, and we are trying to organize in the future perhaps also webinars especially designed for the practicing cardiologists. And I think that the purpose of being in this council is that we can kind of inject some practical cardiology wisdom into the guidelines of the ESC. We know how things work in practice in the office, and it's a little different from the totally academic medicine you often see in the ESC.
Okay, thank you, Per Anton. Thank you, Dr. Sirnes. And I am looking forward to be the best of myself for the next year inside the council, and I'll try to continue your hard work during the last year for achieving the best things for our Council of Cardiology Practice in Europe.
Wish you a good luck as the new chair of the Council of Cardiology Practice.
Thank you very much, Per Anton.